Welcome, my name is Carly Baines, and today I will discuss RxGuard, a DNP-Guided tertiary prevention program on substance abuse. Included in this presentation is a table of contents found on the next slide. Please take a moment to review it if you would like. The following slide lists the objectives for this presentation. Please take a moment to review. There's a growing epidemic in the U.S. 40 people die each day from narcotic-related overdoses. From 2006 to 2014, there were 5,128 deaths from overdoses in the state of Alabama alone. In 2012, the state was the first to have a per capita opioid prescriptions at an astounding 143.8 per resident. That number dropped in 2016 to 121 per 100 residents, which is still amounts to 1.2 prescriptions for each man, woman, and child in the state. In 2020, 91,799 Americans died from drug overdoses, which is a 31% increase from 2019. Nearly 57,000 of those deaths were related to synthetic opioid overdoses. The number of synthetic opioid overdoses has increased more than fivefold over the last 5 years. While overdose deaths are not limited to opioids, the CDC has said that the majority of opioid deaths are the result of prescription narcotics and heroin abuse. According to Alabama Department of Mental Health, opioids are a class of drugs that include heroin as well as prescription pain relievers such as oxycodone, hydrocodone, morphine, and fentanyl. These drugs work by binding to the body's opioid receptors in the reward center of the brain, diminishing pain as well as producing feelings of relaxation and euphoria. A person is more likely to die in their lifetime from an opioid overdose than a motor vehicle accident. This graph shows the increase in deaths in the state of Alabama via overdose since 2015. Reported overdose deaths have nearly doubled since 2015, and opioid-related deaths have tripled. In 2021, there were 31 overdose deaths in Calhoun County. 2022, there were 52. Most of these were men in their 20s to 30s taking medications mixed with fentanyl. In 2021, there were 26.73 overdose deaths per 100,000 people. This was a 45% increase from 2020. In 2022, there were 89 overdose incidents in Alabama Medicaid and Blue Cross Blue Shield recipients in Calhoun County, which is 0.77 overdoses per 1,000 county residents. Now we'll discuss some of the common opioids used illicitly. Heroin is an illicit drug made from morphine that is commonly injected, sniffed, or snorted. It can also be mixed with crack cocaine. Users typically report feeling a sense of euphoria or pleasure. It can also cause dry mouth, warm flushing of the skin, a heavy feeling in the arms and legs, nausea, and vomiting, severe itching, clouded mental function, and a back-and-forth state of semi-consciousness and unconsciousness. Some of the long-term effects from using heroin include insomnia, collapsed vein from injection, damaged tissue inside the nose from snorting, infection of the heart lining and valves, abscesses of the skin and infection, constipation, stomach cramping, liver and kidney disease, lung complications, mental disorders, sexual dysfunction for men, and irregular menstrual cycles for women. Heroin can also contain hidden additives such as powdered milk, sugar, or starch, which can clog blood vessels and cause irrevocable damage to the lungs, liver, kidney, and brain. Oxycodone is derived from thebaine and is a semi-synthetic narcotic agent. Some street titles include Hillbilly, Heroin, Kicker, OC, Ox, Roxy, Perk, Oxy. It's used through IV route or orally. Tablets can be crushed, dissolved in water, and then injected. It can be crushed and sniffed. It also can be crushed, placed on a piece of tinfoil, heated, and the vapors inhaled for a euphoric high. It's known for its pain relief and sedation, but can also cause respiratory distress, constipation, papillary constriction, and cough suppression. Long-term use of oxycodone containing acetaminophen can cause severe liver damage. Overdose can cause extreme drowsiness, muscle weakness, confusion, cold and clammy skin, pinpoint pupils, shallow breathing, slow heart rate, fainting, and possible death. Hydrocodone is a cough suppressant and narcotic used to treat pain. Research suggests that hydrocodone is equally or more efficient than codeine in suppressing cough and nearly as strong as morphine for pain. Hydrocodone is the opioid prescribed most frequently in the U.S. Something that is of high concern with hydrocodone is the use of drug in school-age children. In 2012, 1.7% of 12th graders had reported using Vicodin for non-medical purposes in the last year. Hydrocodone can be found in tablets, capsules, and liquid forms on the market. However, tablets of hydrocodone with acetaminophen is the most commonly encountered source. This drug is not typically illicitly made, but is instead obtained through false prescriptions, doctor shopping, and diversion of medication by healthcare workers. Next, we have morphine. This is a non-synthetic opium. Some street titles include Dreamer, God's Drug, MS, Morpho. Morphine is used only not used to be used only by injection. However, now it's available in multiple forms, such as extended release tablets and liquids. Users tend to prefer injection because it enters the bloodstream more quickly. It also provides pain relief, decreased hunger, inhibition of cough reflex, and euphoria. It can lower the blood pressure, cause sleepiness, slows your breathing, slows pulse rate, and can cause coma and possible death. Finally, we have fentanyl. Fentanyl is a synthetic opioid approved for use as an analgesic and anesthetic. It is approximately 100 times more powerful than morphine and 50 times more potent than heroin. Common street titles include China Girl, Chinatown, Dance Fever, Great Bear, King Ivory, and Murder 8. Fentanyl can be snorted, sniffed, smoked, taken orally, spiked onto a blotter paper, or used on patches. It's sold alone or in combination with heroin and other substances and has been identified in fake pills. Similar to other opioids we've discussed, fentanyl causes euphoria, pain relief, sedation, confusion, drowsiness. Overdose can cause deeper changes in pupil size, cyanosis, coma, and respiratory failure that leads to death. If there's a triad of symptoms, this is strongly suggests opioid intoxication. Each year, opioid-related illness costs the U.S. healthcare system $11.3 billion. 24% of opioid overdose patients were readmitted for additional emergency care within 30 days of discharge. Now we'll discuss some of the risk factors associated with opioid abuse. The opioid epidemic and the HIV epidemic are directly intertwined. Drug use increases a person's risk of developing infections. HIV and hepatitis C can occur due to unsafe needle practices. This will result in lifelong liver damage. People who struggle with addiction often also struggle with comorbidities such as stroke, heart disease, cancer, and mental health disorders. The use of illicit drugs also makes driving a car extremely dangerous and puts the user and their passengers at a higher risk for a motor vehicle accident. In 2016, 12 million people reported driving under the influence of illicit drugs. RxGuard is a DNP-led, community-based approach to decrease opioid overdose in Calhoun County. This tertiary prevention strategy would involve both rehabilitation measures and therapeutic measures due to the strong establishment of the opioid epidemic in the area. The goal of the program would be to prevent opioid deaths, medical complications, and injection-related infectious diseases. This is a three-part program with community drug take-back days, needle exchange program, and a naloxone program. The program would attempt to involve people such as policymakers, prescribers, social workers, addiction treatment and recovery facilities, narcotic squads, police and first responders, the Agency for Substance Abuse and Prevention Program, Calhoun County Health Department, and Northeast Alabama Regional Medical Center. Nearly half the people who reported abusing pain medications in 2020 reported getting them from a friend or a family member, according to Substance Abuse and Mental Health Services Administration. Calhoun County typically offers National Drug Take-Back Day through Agency for Substance Abuse and Prevention. However, this portion of the program would aim to increase the number of community drug take-back days to once a month to give people in the community a safe place to dispose of unused pain meds. This would be held at RMC as it is easily accessible through public transport on the first Tuesday of each month from 10 to 2 in the parking lot where COVID drive-through testing occurred. It would be volunteer-based with community resources such as ASAP, the hospital, first responders, local rehabilitation services, Highland Health Systems, and local nonprofits such as Second Chance, The Right Place, Servants of Jesus, and United Way. Medications would go into the Rx destroyer boxes to be disposed of with RMC's medication disposal. Education on community resources for substance abuse and other programs would be provided to community members who participate in drug take-back days. Next, a needle exchange program would be implemented to help prevent the spread of infectious diseases. One easy and cost-effective way to do this is through vending machines. Around 114.9 million people are living with hepatitis C, and 3 to 4 million people are newly infected each year. The main risk for becoming infected is sharing used needles and syringes. Almost half the people who inject drugs have hepatitis C. The combined use of high-cost coverage needle exchange programs with opioid substitution treatment may reduce the risk of hepatitis C by 74%. This would be implemented through 3 vending machines placed strategically throughout town. One would be at RMC Anniston, one at ASAP in Oxford, and the other one at St. Michael's Clinic. These machines would be purchased through Substance Use Prevention Treatment and Recovery Services block grants, and ASAP would be responsible for ensuring their machines remained in service. At each machine, there would be a sharps container to take back dirty needles. RMC would receive syringes for disposal. The machine would contain kits with 10 syringes and alcohol pads, 1 tourniquet, and 1 fit-pack sharps container with brochures with education on HIV, hepatitis C, a brochure on safe needle use, and a pamphlet with local resources for substance abuse prevention and treatment. Here's an image of what the vending machine would look like with the packs in it and how it has been implemented in other locations and what would be included in those packages. Finally, the naloxone program would be a free online 1-hour training to train on how to identify and respond to an overdose and the use of naloxone nasal spray. The website will also contain resources on local recovery programs, NA meetings, healthcare clinics, and mental health resources. Information regarding community drug take-back days and the needle exchange program would also be included. The training would be posted on Calhoun County's website and would be funded through federal and state grants and substance use prevention, treatment, and recovery services block grants. The program would be incentivized by gifting one free naloxone kit to each person who completed the training. The Calhoun County Health Department would be responsible for the disbursement of the kits. This program success would be evaluated using the pre- and post-program. This program success would be evaluated using pre- and post-program data. Measurements would be taken monthly, quarterly, and yearly. To assess the clinical performance, we will look at the number of naloxone trainings completed, the number of overdoses in Calhoun County, the number of deaths by overdoses in Calhoun County, and the number of community members who participate in community drug take-back days. To assess the financial impact of the program, we will assess the program's overall cost versus the financial burden of opioid overdoses and bloodborne pathogens in the hospital and clinical setting to determine if the program financially benefits the stakeholders in the program. This will be done by looking at the cost of treatment for overdoses as reported by RMC and Calhoun County Department of Health in comparison to the cost of the program. In order to ensure the success of the program, the DNP nurse must have good communication skills. According to the American Nurses Association, communicating effectively means expressing ideas clearly and concisely and disseminating information about decisions, plans, and activities. The DNP nurse must both communicate with the interdisciplinary team effectively in the community in which they are working. The second DNP competency that will guarantee success in this program is relationship building. The DNP leader must be able to build collaborative relationships with external working parties in order to have the other organizations and volunteers to be willing to participate. The DNP leader must build strong working relationships. To summarize, Alabama has a rising opioid issue resulting in an increasing burden on the healthcare system. It's both economic and a public health crisis. While substance abuse is not limited to opioid abuse, the Center for Disease Control has stated that the prescription opioids and heroin account for the majority of drug deaths. Some common drugs include heroin, oxycodone, hydrocodone, morphine, and fentanyl. Overdose costs the U.S. healthcare system around $11.3 billion each year. Health risks include HIV/AIDS, hepatitis C, and bloodborne pathogen-related infections. There's also an increased risk for stroke, heart disease, cancer, mental health disorders, and motor vehicle accidents. RxGuard is a tertiary prevention program offering to seek community drug take-back days, offering a needle exchange program, and offering a naloxone program. RxGuard would be assessed by pre-program and post-program evaluation to determine its effectiveness. There will be both clinical performance analysis and cost analysis. To ensure this program is effective, the DNP-trained nurse must have strong communication skills with the interdisciplinary team and the community members. They must build collaborative relationships within the community. Here's a list of the resources I have utilized for this presentation. Thank you for taking the time to watch.